जब तक समीर सर ऑनलाइन होते हैं तब तक हमारे पास जितने भी मेंबर्स हैं किसी को भी फीलिंग ऑफ 4 सेकंड जो रूब्रिक थे उसकी जितनी भी मेडिसिन है अगर कोई अपनी स्टडी शेयर करना चाहे तो यस गुड इवनिंग सर समीर
Good
सर
evening,
गुड इवनिंग सर
Dr. Pankaj.
यस सर
Can we do one thing? We'll
यस
just continue with the discussion
ओके
about the remedy and the rubric, whatever you want to continue. Then
ओके
after some time, let's understand what people we're talking about.
ओके
Then I discuss. Then I show my case. I had a few cases of Lac humanum,
ओके सर
and definitely I will show one case today. It's very difficult to talk about all the cases.
ओके
It's a very huge and very new remedy, but very excellent remedy. Even today morning, I prescribed one case the Lac humanum. There are a few cases definitely, and I will talk about. Let the people to discuss about the rubric and all.
ओके सर
What I already mentioned, and the differential diagnosis about Lac humanum, which Dr. Kamlesh was talking about last time.
राइट सर
Let's continue with that.
ओके सर
What a remedy came in analysis. We can discuss the differentiate that.
राइट सर
Yeah.
मैं अपनी स्क्रीन शेयर करता हूँ अगर किसी को नहीं दिखाई दे रहा है तो जितने भी मेंबर हमारे पास अवेलेबल है तो लास्ट 2 वीक में हमने जितना भी स्टडी लिटरेचर में से किया है वो डिल्यूजन 4 सेकंड फीलिंग पे तो मेडिसिन डिफरेंशिएशन और सबका फीलिंग जो है मेडिसिन का वो किस तरह से किस किस मेडिसिन में किस तरह से डिफरेंशिएट हम कर सकते हैं किस तरह से वो दूसरे से यूनिक है अगर कोई शेयर करना चाहे तो अपनी स्टडी नीरव भाई आई थिंक नीरव भाई છે આપણી સાથે नीरव भाई रुगाणी सोनील सर
Yeah, good evening, everyone.
यस सर गुड इवनिंग
Yes, it would be very interesting if we can revise and compare remedies with the 4 second feeling along with our understanding of Lac humanum. See, any data, it is difficult to remember, but it is a little easy if we compare and contrast. So with that in mind, it is important that we compare our present knowledge about other 4 second remedies with Lac humanum so that our understanding gets richer.
यस सर
The most prominent one, Mag-Carb. Now everybody knows the orphan feeling of Mag-Carb, and they feel that the people on whom they are dependent on, they are leaving me, and that is the beginning of Mag-Carb problems. Similarly, you see stramonium, they feel that they are being left out in
Wilderness.
a very strange place. So again, that is another aspect of a person who feels that he is all alone in the world. Whatever connection he has or he had developed, they are being severed and I'm left alone in the world. So similarly, I think everybody can put up their views on various remedies that are quite prominent in 4 second feeling. Yes, I would like to invite others also to contribute on this.
यस सर सुभाष भाई
Hello.
यस सर
Thank you, Dr. Shamil. It was really nice one. I just want to add something about Mag-Carb. Main feeling of Mag-Carb is a lot of anxiety, tremendous anxiety. And this anxiety is the survival mechanism of the makeup. And this anxiety is arise out of feeling of not having been cared, protected, or nourished what he needs. This is one of the most important issue of the magnesium carbonica. So Dr. Somil rightly said about the feeling of being forsaken by the loved ones on whom he is dependent for her nourishment and protection. And this is the most important theme of the magnesium carbonica. And I actually talk about the semonium, feeling of being forsaken in the wilderness, left out in the jungle when nobody is there to help him. And that type of 4-second feeling in the semonium, where it gets up with a lot of fear and fright. It leads the person or the furniture. The clinging is very important as far as the semonium is concerned. Now, anybody can share any about macabre semonium?
Yes, sir. Thank you. Yes, Subhash bhai. Subhash bhai or Neeru bhai Rugani.
I have not used Lac humanum, so I cannot comment.
સુભાષ ભાઈ લેક હ્યુમાનિમ નહીં કોઈ પણ મેડિસિન 4 સેકન્ડ ફીલિંગ ડિલ્યુઝન માં.
Okay. Sir, as sir described, I was also wanting with macabre and feminine, but it is also discussed, so let's not repeat it.
I was searching a 4-second feeling from the repertory, and from the Kent repertory, I have seen that at two places. The one is the 4-second feeling as it is, and the delusion 4-second or abandoned. In both the rubric, there are different remedies. So first we have to understand actually the 4-second feeling is a delusionally way, or it is a real 4-second feeling is a feeling way. So because the different repertory is the compile, they
Neeru bhai no voice disconnected, but it's already case we have discussed, and the final conclusion was hello.
yes.
Yes, Neeru bhai, અવાજ આવે છે?
હા હા મારો અવાજ સંભળાય છે કે નહીં?
हाँ जी. तो लास्ट सेशन में हमने ये डिस्कस किया था कि जो उसका फीलिंग लेवल है वो डिल्यूजन पे है. 4 सेकंड है नहीं लेकिन उसको फील हो रहा है. दैट इज नॉट रियलिटी, उसको फील हो रहा है, दैट इज डिल्यूजन. यस, तो अभी डिल्यूजन 4 सेकंड फीलिंग के जो हमने ये रूब्रिक है उसमें अभी अवेलेबल मेडिसिन इतनी है 72 है अभी, ये 2016 का है.
I am totally agree with the Sonny sir and about the macabre and Samir sir, that the concept of basic need, care, and once they don't get it, they feel it, and their reaction is the compensation type of reaction. So in every remedy, the feelings and the reactions are both important. Like what the sir says about the stramonium, feeling and the reaction of clinginess and fear. But the same way, Argentum nitricum, if you see. So there also, there is a insecurity and that feeling of forsaken, and they try to shine, attract the people in that way, so that they are being considered. So that is their reaction. Even in Argentum nitricum, if you see, there is a anxiety with insecurity and the deeper feeling of not recognized. And that not recognized feeling, that they we have considered as a 4 second in this, if we try to connect with this rubric. And that is why the reaction is to show, to shine.
Right.
Hello.
Okay. Yes, sir.
Yeah, I'm definitely totally agree with Dr. Nirav. Beautifully talk about argentum nitricum. But here I just want to add something. There is strong feeling with neglected and despised in argentum nitricum. If he cannot perform in this time of crisis, so there is performance is very important in argentum nitricum. If he cannot perform, then he feel he has been neglected and despised by their own people. And this is what the 4 second aspect of the argentum nitricum is. Right, Dr. Nirav bhai?
Yes, sir, true. But I was trying to understand the argentum nitricum, which is 5 mark in this rubric. So
Yeah,
how
yeah.
we can understand this argentum nitricum as a 4 second feeling?
See, actually, here most important feeling of neglected and isolated and feeling of failure if he cannot perform in crisis. That's the most important aspect of the argentum nitricum, what I understood.
So, true, sir. So now
And
here it is
would I
a,
like to-
open
so-
window for us to understand the
Ah.
4 second feeling is not actually 4 second feeling in argentum nitricum. What you are saying is,
Yeah.
so even in all other remedies,
Ah.
which is in a 1 mark also,
Ah.
there is actual not 4 second, but the there is a different feeling which is related to it.
Yeah.
And the person who have compiled this repertory, he has connected this feeling with the 4 second feeling, and he has put this remedy in this specific rubric.
Yeah, maybe, yes.
And another important thing would be if we can simultaneously see the reactive pattern of a particular remedy through
Yeah.
other rubric that comes up with that. Like
Yeah.
as somebody, as Dr. Nirav said about argentum nitricum, we can also see how the effect of that feeling will proceed to create a lot of anticipatory anxiety and lack of confidence.
Yes,
So a person who feels that, yes, I am left out and I am not being treated justly or not judged properly, now I am developing lack of confidence to do anything, and I'll have a tremendous anxiety when something is anticipated. The reaction also can help us to differentiate not only the feeling, but along with feeling, as Dr. Upadhyay said about the clinginess of semonium. Like when I feel I am left out alone in a strange place, I'll cling to whatever that can help me.
Yeah,
That will
definitely.
be my
Absolutely.
reaction to compensate the strong 4 second feeling. So if we can look into those aspects, it will help us to create a better picture of the particular remedy.
Yeah, absolutely right. Doctor.
Even so, if we take a platina, so we are having a picture of a platina if a high self-esteem and ego. So we have never think of platina who was feeling a neglected or forsaken.
No,
But
what is
here-
platina? Yes, platina feeling of being queen or king.
Yeah.
Due to that feeling of 4 seconds from the world. I am separated from the world or isolated from the world, as I am more higher than the other people. This is 4 second feeling of platina. Due to that egotism and more higher than other people. I am isolated.
It is being alone at the top.
Yes. I am on the top and other are below me. Same way in the Aurum. What is Aurum? That he has to perform duty much higher than his capacity. If I cannot do, I will be isolated.
Yeah,
Okay.
absolutely like Dr. Jaivat.
Yes, and in Argentum, there is one word, very good word, crisis manager. If I cannot perform in crisis, then I will be isolated or I will be forsaken. So
the feeling of cyclamen, as Dr. Daivat has said, they are also like aurum. They have a feeling that they have neglected their duty or they have committed some crime, and that guilt is causing them to avoid company, and that's how they then go into the delusion that they are being forsaken. Actually they avoid because of their anxiety conscience of, they avoid people and they feel they have committed a crime.
So in cyclamen, if you look at, there is a strong feeling with criminal,
Yeah.
as if he has done something wrong, he has done
Yes.
some crime, and which cannot be rectified. This is
Yes.
very important thing, that whatever he does, he or she has done, it cannot be rectified.
Correct.
That is very important thing in cyclamen. That's why it feels forsaken and left out.
Yeah. First, they only isolate themselves because of their
Yeah.
guilt, and then they
Yeah.
go into this feeling of forsaken.
Yes.
Yeah.
So since our discussion in this discussion, we are seeing the actual central theme of a particular remedy, and that theme is most important rather than the forsaken. Like what we have discussed about cyclamen, aurum, platina. Actually, we see the central quality of, suppose platina is central quality of a egoist. We never think of platina in a forsaken, but now we are trying to understand the forsaken feeling in that way, that he is in a, or she is in a high level, and that may think about herself that she's forsaken. But so if we see the real forsaken feeling or the related to it, the feeling related to it, or how we are trying to connect the forsaken in the real feeling of that particular remedy.
नीरव सर, वो सोमिन सर ने बताया ना कि we are trying to understand the different patterns of the particular medicine, how they behave in this situation. forsaken feeling जो है उसमें हर मेडिसिन किस तरह से अलग अलग तरीके से बिहेव करता है, उस तरह से हम उस मेडिसिन को ज्यादा डिटेल में समझ पाए, अंडरस्टैंड कर पाए. और यस, एनीवन? साइक्लामेन
I
के
think there are some basic issues that have come up in the discussion, Dr. Pankaj.
Yes, sir.
The question came up when Dr. Rudani talked about the gradations, and we are taking one rubric for second. Then the point comes up is that how the rubrics are made in general. If we understand that, then maybe we get answer to our questions.
Dr. Kamlesh sir, if you can remove the mask, if it is not important, then we would be able to understand you better. Are you in a public place where you need to put the mask?
I am in the public place, and if I remove, I may be behind the bar. and from there I can talk very easily.
That is a better option.
So please bear with me.
Okay.
Is it difficult to understand my pronunciation or my voice?
No, it is better. Doesn't matter. I think it is okay. Please continue.
Okay, thank you very much. So the point is that whenever rubrics are made, rubrics are a theme. Various symptoms are collected together, which is a common theme. And a title is given to that theme. So whichever drugs are there, wherever there is a feeling of forsaken, loneliness, despised, deserted, left out, or alone, all these words are taken from various provings. Now this may be from the same remedy, various provers, and they are presenting the feeling in the different words. But even then, the basic idea, the theme is same. So they all are included under one word. There is, for example, forsaken. Now person may be telling, I am abandoned, but it is taken under forsaken. Now the point is about the gradation. I think this point is clear how the rubric is, the word is taken, the title is given to the rubric.
Yes, sir.
Okay. Now the point comes about the gradations. Now these gradations are with the purpose to highlight and give idea that how frequently they had appeared in the proving, or to put across the idea that what was their value in the clinical practice. So if it is appearing in majority of the prover or at the most instances, then they are verified. So they are verified. And then they are confirmed in the practice that when it is given, it has removed that symptom for which it was prescribed. So in that situation, then gets the highest mark. It does not mean the remedy with the lowest mark is of less importance. That only means if the remedy is of 1 mark, that only means that they were found in the very fewer provers at the less occasions, but they were found, okay? Or they were not found in the prover at all, but they were found in the clinical practice, whereby it is not there in the proving. But after giving a dose, what happens that symptom goes away, and that is why that remedy is taken up for that symptom. So is this point clear now?
Yes, sir.
How the
Sir, I
rubric
would
is
also
made?
like to, I would like to have some more light on the fact, the intensity. Like, if argentum is noted with 5 marks or 3 marks in certain remedies, the intensity of anticipatory anxiety, like how intense that feeling is, does it have any relevance to that? Like I
No,
may feel
Dr.
anxious,
Rudani.
but it's
No,
okay.
no, Dr. Rudani. This has been very clearly stated. This has been very clearly stated by Dr. Bonavisen in his article, Affinity for Drugs. And thereby, intensity doesn't matter, the quality matters. Intensity is the manner that in how many instances it was noted. And it was noted, then how many times it was checked. So in various provers it is coming up, and then if it is confirmed during the practice. These are the 3 criteria. At how many instances coming up, how many times it is verified, and then lastly, how many times it is confirmed having the clinical practice. So intensity has not been exercised by Dr. Bonavisen, who had introduced the idea of gradations. Moreover, gradation was also practiced and added in the synthetic free repertory. We know that synthetic repertory is based on Kent structure. So there are 3 gradations. But Dr. P.L. Smith added 4th gradation with the idea that if there are so many drugs coming up in the case for, and one symptom that is very prominent, and that prominence is more seen in the clinical practice, say irritability in children, chamomilla. So chamomilla capital, bold, and underline. So he added 4th grade in synthetic repertoire. But otherwise, the intensity is not notified by any of the masters. So, construction of rubrics, anybody has any suggestion or question?
I think Sonil sir, the intensity is marked in a materia medica rather than the rapid. Kamlesh sir has rightly said about the conceptual framework of the repertory and how it has been formed. With the instances, it has been proved, reproved, verified, and re-verified. That way, it
So
has been marked.
that is why in Bonimuson's repertory, the 1 mark is given under bracket, stating that it is a doubtful. It requires a confirmation. It has come up in some of the cases, or maybe in the clinical practice. But very frequently, we require to give the observation to raise it to 2 marks. Okay?
Yes, sir.
Okay, we got it.
Now the second point is various remedies under one rubric. So thereby we have to see the 4 seconds. Is this 4 seconds a dispositional quality, or it is a reaction and outcome? Usually what will happen, patient will say, I will feel 4 seconds. Now, for example, make card. I don't know how many people have gone through make carb synopsis, symposium volume F. Dr. Dhaule was the one person who extensively studied with Dr. Kasad magnesium carb and correlated physiology, pathology, and psychology with dreams, because symptoms are very few, but mind is more from the dreams. And for dreams, he connected with the presentation of the psychology. And then that has been connected with the muscular, neurological, immunological reactions. And in that, this basic feeling that I don't have the enough love, I have not been given, or there is a more demand of the love. This comes as a dispositional quality in magnesium carb. It is not that the person is orphan, it is not situation that person is not given love. It is the inner demand that I have not been given enough. I am lacking. That experience has been derived from the dreams and various aspects of the insecurity. In magnesium carb, all the dreams are mainly related to insecurity. Dreams of falling, unsuccessful efforts, and various dead bodies, dreams of dead and death. So various aspects are coming up with insecurity, and magnesium carbonicum, this insecurity, we find it with anxiety and sadness. See, always there are 3 basic fundamental emotions that Dr. Bogeres said to make our study very easy. Which emotions are fear, sadness, and anger. Rest all are combination of these emotions. So in magnesium carb, in every remedy, whenever a person is upset, all the 3 emotions are likely to come up in various degrees. Now in magnesium carb, we see insecurity, there is fear and anxiety. There is expressed in the form of sadness more, because there is a communication problem that is expressed and found in the cases of magnesium carbide. This communication is more seen in the dreams rather than verbally. And that is why we find anger, but there is much more repressed. And so insecurity and sadness supervenes in magnesium cards. So we don't find the effect of magnesium carbs at the tissue level so much speedily the way we find in calculator cards. It has been described that magnesium carbs whereby body is like calculator card and mind is like network. It means there is a prolonged grief, prolonged effect of the emotions, and that person remains with it. Whereas body is inactive, not reacting very evidently like self-care. So here we understand 4 seconds as a dispositional quality. I don't know what is the opinion of group about whatever I said.
Absolutely true, sir. Nicely mentioned in the paper in Symposium volume, but here also the connection of the symptoms as a physical level was elaboratively described, like spasm, the slowness, uh, and the effect on the each and every system. So
Absolutely
that
fine.
kind.
Absolutely fine. See, here we are not talking about the make carb in detail. I'm just telling you how whenever we are studying any rubric, there is always a situation, there is an experience, and there is an outcome. And also there is a fourth thing, there is a reaction of the patient.
And sir,
I
also
said fourth
tissue affinity, the affinity of the remedy to
and
act on the particular tissue level and the kind of effect.
Rudhaniji, you will not be left out. I've already covered that. I say again, number one is the situation, second is the experience, third is the outcome, and fourth is the reaction. And under reaction comes emotional, intellectual, or physical. The tissue injury. So whenever there is an insult, hurt, or devoid, or excess, ultimately it injures tissues, muscles, organs, and system. The point is, how does it is registered in the system? First mind, psychosomatic, or first body, soma, psychosis. So what you are talking is the affinity of every drug has certain tissues. And you rightly said magnesium carb has two main affinities. One is the muscle and second is nerves. And of course, bones and GIT cannot be overlooked. So muscle or nerve, wherever there are irritations because of excess or deficiency, there is a cramp and tissue irritability coming up. Spasm setting, convulsions coming. So, but that is not our subject of today to discuss the affinity, the sphere of action, and connection is with the psychology, psycho, neuro, endocrine, and immunity, RES system. Our purpose is to study 4 cycles in various remedies. So now what supervenes in argenticum nitricum, in every whenever somebody is left out or somebody is having the abundant feeling, rejection, then obviously pain will come up, that is sadness will come up, anger will come up, and anxiety will come up. So we have to qualify remedies at these 3 levels and find out what is supervening in particular remedy. Argenticum nitricum, when there is a feeling that I have been despised, I have been left out, it produces anxiety and restlessness more profoundly. It may be accompanied with sadness and irritability, but what we find more profoundly, activity, hypermetabolism in terms of restlessness or hypermotility of intestine. The sphere of effect is intestine. Here, the intestine moves far more than required and so produces loose stools. In magnesium carb, loose stools may come up, but more profoundly, it is producing inactivity. And so there is a severe constipation in the remedy. So we have to see different curative powers in different remedies. Situation is same, but their disposition is different, the sensitivity is different, their experience is different. So outcome felt is different. So quality is different. At the same time, reaction to the world or reaction on the tissue will be different. We have discussed platina. Platina, one thing, we fix up the drugs into certain image because that is very easy for us to remember. And we connect platina with ego. So it is not always heightened ego, but it is also many a times loss of ego. One is holding high esteem or the high ego, which is broken. And we know platina is also there in the timidity in the public. Mildness alternating with sadness. And platina is one of the remedies which has lots of reverences around. Platina is calling for help. We have to understand when one is having a full of strength and one who is having lack of strength. In every situation, the remedy is likely to come up with its curative power. So rather falling into any certain image of the remedy, if we can focus on the qualitative aspect and its presentation is given in the mathematics. Tremonium. Tremonium, what is likely to know, the action is clinging. What makes the clinging happen? There is an underlying panic. inability to cope up with the situation, because that problem is much more giant than one can manage. Does not have that much capacity to deal and the courage to deal. So stramonium goes into the panic, goes into perspiration, palpitation, and stammering. Nose does not sustain that load, that problem that comes across, and person cannot face it. And that is why that from the action and the panic, the person gives that, oh, I feel alone. There is nobody. I want company. Basically, there are lots of fears. Everything around him is a threat. Darkness is a threat. Ghost is a threat. Every situation, he feels he is being injured. These are all our hypothetical things. But if you select the picture of one patient, there may be different variations in different patients. So don't make any image and don't make any definite picture. स्टेमोनियम ऐसा है, स्टेमोनियम ऐसे ही बिहेव करेगा, स्टेमोनियम में यही होता है, स्टेमोनियम में कुछ नहीं होता है. स्टेमोनियम has the capacity to cure such portraits of disease. The group can give their opinion. Hello?
Yes, sir.
Hello?
Yes, sir.
I hope I am audible enough and
Yes, sir. Full clear.
okay, so if group has something to say and if that solves our issue of how to differentiate remedies and how to go about and understand even Lac humanum, that we can study it little more in detail and understand after Dr. Samir Upadhyay's sharing of his experience and what his in-depth study of the remedy. So if group has nothing more to say, we can take help of and guidance of Dr. Samir Upadhyay.
Yes, sir. Yes, Samir, sir.
Hello?
Please. Yes, sir. Audible.
But anybody has to say, Dr. Sonil, Dr. Rudhani, Dr. Dabuwala, Dr. Sunita Agrawal. Anybody wants to say something? Kinjal, are you there?
Yes, sir.
This session, this group has been initiated by Dr. Kinjal, she's intern. And her friends, they have taken all the efforts to start this group. And Kinjal, now we have almost 180 members in your group. So whatever is discussed here, you have any questions? Because this group is by students, for students and interns. And practitioners will help students to learn better. Hello, Kinjal.
Yes, sir. No, sir. Today I don't have any questions right now, but I got a good understanding about how to differentiate remedies in a rubric.
Okay.
Yes.
Hello.
Okay. If there are no, yes, please.
Yes,
Hello,
sir.
Pankaj, am I audible?
Yes, sir. Clearly audible.
Fine, fine. Yeah, I'm absolutely agree with Dr. Kamlesh Bhai. We are not to make any fixed image about the remedy. See, this is very important thing. In every remedy, you see the two different poles. with every remedy. He was talking about platina, where he said reverence for the people, those around him. One side we see the superiority complex. That everything depends upon the situation, how person is in the situation and how he is reacting to the situation. That's a very important thing. And one side, if we look at the opposite side of the platina, there's a lot of begging, entreating, a lot of praying. See, imagine that being a king, being a superiority person of a superior rank or superior person, you get the exactly opposite picture. The begging, entreating, the praying, seeking help for. So imagine if you made one image about the remedy, the platinum only have a superior complex. We cannot go into that such type of cases. We cannot treat such type of cases. That's very important thing. Again, in the case of semonium, Pankaj Kamlesh Mehta very rightly says, there is one beautiful rubric semonium has, light desire for sunshine, society, and mankind. See, one side we talk about a lot of darkness, a fear of darkness, lot of panic, and one side you have a strong desire for light, sunshine, and society. See the two different opposite aspects in one remedy. This is what we have to understand with every remedy. This is what I want to share about. Hello.
Yes, sir.
Anybody want to say something about it? Or any Dr. Kamlesh bhai?
Yes, anyone? Yes, anyone want to add? You can add, please. Okay.
The point has come up about polarity.
Yeah.
This idea of polarity has been coming from the Western countries, and it has been taken up by us. There is nothing wrong. We can take it up. The point is how in actually proving has happened. In proving, people of different disposition has taken part, and people have a different situation to live, and they are
Yes.
passing through different stresses. So all the different type of people, when they are receiving particular remedy, they express as per their resources that is within, their capacity, their energy, and how they will be dealing with it. For example, we have Cilicia, and Cilicia has been known for full of grit and lack of grit. So it means there are different ranges of people who participated in the Cilicia, and they reacted as per their capacity. Likewise, we have Lycopodium at one point very dictatorial. On the other end, we also find Lycopodium useful even in the people who has a timidity and who are important. What does that mean? It means every remedy can help in all the different type of people having a different reaction or the capacity or emotions. If it is lycopodium anger, then it has to match with the lycopodium anger which it produced in the proving. If it is a lycopodium timidity, it has to match with the lycopodium timidity that was produced. So rather than polarity, we have to understand every remedy has capacity to alter every aspect of the human life, all the emotions and all the tissues. But some in more manner or some in the less manner, some very early or some very late. But it is the holistic affection. So entire economy of the human being is affected. If you understand that, then remedy affects all the genders, for all the ages, people of all the religion, and all the culture. So this is a small point which I thought I should share with you.
Absolutely right, sir.
So, sir, can we go about your case?
Sure, sir. So, as such, I
Thank
cannot
you very
share
much.
this case because lack of time. I just came at
Yeah,
9:30 from the
and your
clinic.
experience.
Fine. I
Okay.
just tell you the case in short. Yeah, that will be better.
And your experience of receiving the case, understanding analysis, and coming to
Yeah,
the remedy and the effect of the remedy.
yeah. Fine.
Okay.
So this was a
So
case.
now we will have, yeah, okay, we will have an insight of Dr. Samir Upadhyay about Lac humanum. Thank you, sir.
Sir, just I want to tell one thing. It's a very
Hmm.
important. I'm not talking for any individual person. So it's in general that nowadays what I experience, there are so many newer remedies coming up, and we have to understand all the different aspect of the newer remedy. Just I want to, before I go with my case, I just want to tell something. Just now, for last few months, I'm having so many cases of Triticum vulgaris, vanilla, and Funiculum vulgaris. These are new remedies that coming up, and which I started studying the different aspect of these new remedies. And when I study the new remedies, and when I started thinking introspectively and thinking about the remedy, and where I made so many mistakes in the past. These are the remedy. For example, the vanilla. When I talk about the vanilla, when I started understanding the vanilla in thoroughly, where I understood where I made mistake in past. For example, the death of loved ones or the grief, we straight away prescribe Ignatia or the Natrium muriaticum. And this is one of the most important remedy, vanilla. We don't know at that moment. I don't know that time. When I started understanding the vanilla in thoroughly, I realized, see, I gave a Natrium, I gave Ignatia, patient was better. So I feel my remedy is work. And I'm happy. But I didn't understood at that time whether patient is better completely or not. If she came with migraine, a migraine got better. So I was happy and patient was happy. But when I started understanding or started thinking retrospectively, then I realized what was the mistake I made. I just want to talk about these are the few newer remedies coming up. And with open-minded, just accept the proving, just apply that understanding into your cases. If you feel it's worth applying, you get the results, accept it, otherwise just discard it. This is very important thing. And this I'm using so many newer remedies nowadays. And with this has a very few proving. Proving are not available, complete proven. But still I'm getting fantastic results. So with this, I just start with my small case of Lac humanum. Basically, she is a homeopathic doctor, 40 years age. I treated this case around 7 or 8 years back. She came to me with a complaint of prolapsed intervertebral disc. She had a problem between L4 L5 level with canal stenosis, a lot of neurological problems. Both the lower limbs feels completely numb. There's a lot of tingling and numbness. She used to feel as if there is no energy in the leg. That with lot of back pain. She cannot sit for a long time. She cannot walk for a long time. If she walks, She had extremely excruciating pain. She has to take rest. The most important modality was she feels better by warm application. Along with that, she also had a PID, a pelvic inflammatory disease, with profuse leukorrhea. The leukorrhea was very, very offensive, very stringy. It was so profuse, it just running down up to the legs. And this leukorrhea was yellowish in color and difficult to wash off. Her menses were regular, but she used to complain a lot of heaviness of the breast before menses. She is unmarried. She was unmarried, and still she is unmarried. But her sexual desire increased a lot before menses. So this was a chief complaint. She came for me. When asked about the mind, see, basically she's homeopath. So we have our conversation was totally different. Just tell me about your mood, about yourself as a person. Straight away she says, I'm very angry person. Lot of anger. And when I get anger, I cannot control myself. Anything can happen. I become very violent sometimes. I don't know what I will do when I get angry. It is very, very impossible for me to control my anger. But sir, one thing I tell you, whenever I get angry, immediately within few minutes, I go to that person, I say sorry. Whoever it may be. Within few seconds, few minutes, I just tell him sorry. It was my mistake, please pardon me. And what she says, sir, when I think about my life in the past, there are a lot of I am being abused a lot by my own people, by people who are surrounded me, my parents, my brother and sister, my uncle, my auntie. They all have abused me a lot. There is abuse, verbal abuse, there is sexual abuse, there is a physical abuse. I can say all kind of abuse I had in my life. Then also my near and dear one, and particularly my mother. My mother abused me a lot. And since then, I started having guilty, not a guilty, it was a dirty feeling for myself. That was, I had a feeling of very low about myself, very low about myself. That was the most important issue. And she was so talkative throughout the case. She was just talking non-stop about a complaint, about one after another complaint, one after another people she was talking about. One thing was very prominent throughout the case. When she talking about her family, she was constantly complaining about the problem in the relationship. That issue that emerges very strongly throughout the case. Constantly complain about the mother, complain about the brother and sister, complain about the father and all the relatives, non-stop. I hardly asked any questions in between. She was so talkative, so loquacious. That was the most important issue that came up. Basically, she was very, very fastidious. The mood was extremely changed. Mood changes very frequently. There is lot of conflicts within herself. When she talk about, she talking all the time two different sides. And she was always comparing herself with others. And with the comparison, always feels himself is a lower side. She is better, I am not that better. She's constantly comparing. And when asked about the dreams, she said, I am very, very frightful dreams I get. She told me about the 2, 3 dreams. I don't remember just now, but it was very frightful dreams. And she had a very strong craving for eggs, sweets, and chocolate. So that was the case of homeopath. See, I tell you the follow-up first. It was a beautiful follow-up. The very next day, she WhatsApped me. Sir, my leukorrhea is 80% better. She also had an urging for urination, and her bladder tone was weak. She has to pass urine very frequently, every 2 hourly. That was another complaint she had. So she said, my leukorrhea 80% better very next day. My urging of urine is still there every 2 hourly. Then on third day, she sent the message. My urging of urine is now better now. Now I can hold the urine for 3 hours, 4 hours. My leukorrhea is almost gone. And my backache, I also started feeling a little better in my backache. But I know this is a long last problem, so it will take time. After 7 days, she again sent me a message. My backache and my leukorrhea and everything is better now. Still, she is coming regularly with me every month. I didn't repeat it a single dose for 6, 7 years has passed, and she is doing very well. Once she had a backache, when she lifted a heavy weight, and she had acute backache. At that time, I gave 1 dose of Lac humanum. So I just tell you the rubric which I consider the symptoms. First symptoms I consider the loquacity. Second, anger alternate with a quick repentance. So this is very, very important aspect of the Lac humanum. Almost I've seen in every case of mine, anger alternate with a quick repentance. Another very important is lamenting, mourning, relentless about human. She was constantly talking about the problem in the relationship.
So sorry to interrupt. Will you please repeat what you said? Which are the consistent features that you saw in Lac humanum?
Hello, sir.
Yeah, Samir sir, if you can repeat, what are the consistent features you saw in Lac humanum? I just missed it.
The most important I came across in so many cases. I had around 6 to 7 cases just now. In all the cases, almost all the cases, I have seen the anger altered with the quick repentance. That was very prominent in all the cases. Almost in 50% of our cases, I have seen the problem in the relationship. See, with the human, see, I'm using the word problem in the relation with the human, about the human. And that is very, very characteristic symptom I came across by 50% of cases. So I took a rubric lamenting relations about human. The single remedy was mentioned is Lac humanum. I took a dreams, frightful nightmares. And it's about chocolate and eggs. Remedy I prescribed was the Lac humanum 200. Hello.
Yes, sir.
Hello.
Yes, sir. Yes.
Am I audible? No? Fine. Okay. What I understood is in Lac humanum, there is constant conflict. So from where the conflict arises, if you look at the animal side, and who created the conflict? Who created God and evil? So where the conflict started? This is God, one side God, one side evil. Who created God and evil? Naturally, the human beings. If you look at the animal side, you won't find any division in animal. They all are same. There is no division. If you try to understand the human beings, they created the conflict. They created uch and niche. See, if you see in human beings, lot of things are very common. See, being a human mind is very messy. Mind is very messy mind. So one thing is very common you see is its operation, the exploitation. This is very, very common in the human being. So this exploitation, from this casteism, from this colonization or caste system, all these conflicts develop in human body and human mind. And what happened? The exploitation is what where you find man by the man. Exploitation is man by the man or man of the man. So this human being created all these problems. So if you have to understand the Lac humanum, first you have to understand the human being itself. If you understand the human beings, its psychology and all, so it's very easy to understand the Lac humanum. The constant conflict is going on in Lac humanum. Constant conflict. See, conflict between materialism, conflict between spirituality and materialism. Very common we come across. So many things. Human beings, there are a lot of division I already talk about. Division between myself and others. See, these are the very common things that are coming up in so many cases of Lac humanum. See, there is one symptoms, one rubric or symptoms that came up very prominently in the proving when Dr. Rajan Shankar was proving this remedy. He proved this remedy 3 times. When I'm talking about the one symptoms, this is very important symptoms, is embarrassment to eat into a presence of others. Embarrassment to eat in presence of others. What it means? Again, there is a conflict is there. Here, if I have to eat in presence of others, so either I have to share it, share the food to someone, or you should have a guilty feeling. Again, there is conflict. Same as there are lots of conflict going on, lot of abuse going on in all the Lac family, lot of me versus others, lot of superiority and inferiority. These are very, very common aspect of the Lac humanum. And one thing very important I came across in few cases, the conflict between materialism and spiritualism. This is very, very common come across. See, if you are human, you think about a lot of materialism. The two aspects you think of, materialism as well as spiritualism. When you think about the materialism, they think about money, they think about everything. exactly opposite is the spiritualism. So we'll see two opposite sides. So there were beautiful rubric as mentioned. Conflict between higher consciousness and worldly existence. This is very, very important aspect of the Lac humanum I came across. In some cases, this is very prominent. When you are, see, when you are on the human side, you do exploitation, you have egotism, you have a selfishness, you have a wealth issue, you have power and position. When you are the spiritual side, you have lose a sense of wealth. You become benevolent. You become spiritual. You start helping others. A lot of sympathetic attitude. We think about the spirituality, spiritual aspect. And when you think about a human aspect, there are a lot of egotism and selfishness came up. The two different aspects of human beings that came up very strongly, persistently in the Lac humanum. And this is very, very important thing. And there is, along with that, there are a lot of problems, lot of themes that arises, lot of indifference that arises, lot of anger that came up, lot of irritability. So again, you said the two sides. Problem with the mother, a lot of attachment with the mother. Irritability towards the children, there a lot of care and worries about the children and loved ones. Anger, one side you have a lot of anger, one side you have a lot of love and care. See, constantly two different sides are coming up in the Lac humanum. It is very, very strong. One side you find a very strong aversion to company. One side you see the strong desire for company. The two different aspects. I'm just, when I think about Lac humanum, continuously two different aspects running through and through. In one patient, almost in every case. This is the more important thing was. And the 4-second feeling, this is very, very strong. 4 seconds by loved ones, 4 seconds by mother. And there is a lot of issue with the breast and the meme. So we'll find very strong fear of cancer. Fear of cancer of breast or fear of cancer of meme is one of the most important fear I came across in 3 cases of the Lac humanum. This is very, very strong. And I already talked about the selfishness and all. So this is always, you see the state of human beings are always having a division between myself and others. This is again a very strong issue. See, one strong issue came up throughout the proving of Rajan Sankaran, what he was talking about very strongly. The theme of cousins. Theme of cousin is very important thing. So what is cousin? Cousin means what? Cousin are those whom you are not duty bound to help. See, they are not your own close blood related people. They are distant relatives. So you are not bound to help them. You are not duty bound to help them. These are the cousins. The issue came up very strongly. But if you help them, then you feel good. See, two different beautiful aspects that came up. You are not bound to help them, but if you help them, you feel good. See, if you look at in general, for example, if something happens to your own people, your own loved ones, your father, mother, your wife, or your children, then you don't have a choice just to go and help them. There's no choice. But if you think about the cousin, there is a choice. Not necessarily that you have to help them. But if you help them, then it looks good. If you don't help your loved ones, then it becomes a criminal. You become a criminal because it's your duty to help your loved ones. So again, the two sides came up very strongly in the proving. So here, what I understood is what is disease is. See, this is completely different. I don't want to go into the some more problems in that. This is what I understood is what is disease is. That's when I was reading this article about the proving of Lac humanum. Then this stuck in my mind. Then I started thinking about it. What is disease is in general. So disease is a point of stuckness. The point of stuckness is where you get stuck at a particular perceptions or at the particular sensitivity. This is your disease. For example, you stuck at the perception of exploitation or at the inhumanity or at the corruptions. Sensitive, you are stuck at the sensitivity of corruptions. This is your disease. This is what I understood disease is at the point of stuckness. And opposite is the health. So this is what I wanted to share about the Lac humanum. Hello.
Yes, thank you, sir. क्या एक क्वेश्चन पूछ सकता हूँ सर?
Yeah.
ये जो लास्ट आपने केस जो बताया लैक ह्यूमन का, उसमें दूसरी कंप्लेन थी, जैसे कि आपने बताया कि एंगर ज्यादा था, में कुछ चेंजेस हुए?
Definitely. Now she had a very good relationship with everyone. She started accepting the situation. The tremendous improvement, tremendous.
जो मूड चेंजेस होते थे बार बार, frequently.
Definitely, yeah. Everything is fine. She's cooled down a lot. She cooled down a lot. Every respect. And one thing I want to share about this case particularly, I don't know, Kamlesh will talk better about that. The one rubric has been taken, anger contradiction from. Right? Here, I don't feel there is any issue with the contradiction. This is what my understanding of the case is. Kamlesh was the physician. He can understand it better. He can talk better about that. I had a feeling that here, when his will, when things did not happen as per his will, he used to get angry. So I, rather than taking anger contradiction from, I would like to take one symptoms, anger, will, if things do not go after his will. There are only three remedies, Lac humanum, thuja, and vanilla. Hello, Kamlesh bhai.
Sir, the rubric is the right one. Point is that you said it has only three remedies.
Hello.
So, am I audible?
Yeah.
You said about the contradiction part in the case, and for that you feel more appropriate rubric is not things happening as per the will.
Yeah.
Right. So
yeah.
Will is a wish. Will is a wish.
Yeah.
And if things are not happening as per the wish, it is going against it. And so the broader rubric is contradiction.
Okay, fine.
And as suggested by Dr. Ken, and we understand from even Boni Hussain that it is always advisable to take a broader rubric, general rubric, rather than very particular rubric, because particular rubric, if we take from begin with, it will reduce the number of the drugs for the selection.
Yeah.
It is not important that which rubrics are of Lac humanum. We have to take the rubrics of
Yeah,
the
yeah.
patient,
Yes, yes,
and then we
definitely.
come to Lac humanum.
Yes,
So
yes.
for that, so that becomes a very particular rubric of the general rubric contradiction aggravation intolerant of.
Okay. Okay. Okay, fine. Okay. Thank you, sir.
So it is a good experience that Dr. Samirbai has integrated and presented to the group. And in case is just one event. Case is just one event. Just a moment. Okay, I hope I'm audible.
Yes,
The
Lord.
case is, yeah, case is just an event to understand analysis, integration, and application to homeopathic fundamentals. So that is where we want to focus on what is the thinking process of doctor. Uh, any physician or doctor is going across. Likewise, in this case, what Dr. Sanirvai has thought of. Now, again, in this, we understand situation, we understand the outcome. Patient usually talks about two things. In this situation, I behaved like this. Now, physician like Dr. Samir Upadhyay, who has a experience and a keen skill of inquiry, will also fill up the gap of circumstances and behavior with the experience of the patient. So, what in this situation, why did he behave like this? What made to behave like that? And then what comes first is the reaction. We talked in the earlier part four things. There is situation, experience, behavior, or
And
action,
reaction. And
and
reaction.
reaction. Now, if when the moment we put across this and connect these dots, then we have the complete quality of the symptom. Rubric wise, we may get various drugs, but quality wise, we will find only very few drugs having this that quality, and more prominently only one. And that is why totality of symptom will have its own value. So what otherwise we tend to do, how many rubrics are covered? It is not important how many rubrics are covered, but how the things are happening, anamnesis, morbid phenomenon, and the experience and the reaction of the patient. Because experience that comes from within, circumstances come from outside. Behavior is coming to strike to have the comfort or survival. But the experience that one feels that comes from the disposition, and reaction usually comes from the reaction. Reaction comes from the disposition, or it may be circumstantial. So more important is the experience of the person. Now, for an example, if I extend my hypothesis and imagination, that Lac humanum patient, when he's eating, he feels that he has to share with someone. So sharing is his behavior. If he does not share, he goes into the guilt. Why does he go into the guilt? Then, if we connect to his conflicts about the relationship, then if I don't share, then what will be my reaction with that, my relation with those people around? So now we are connecting two things together. And that is why we find usually one of the very strong features, I want to be included in any condition, I don't want to be excluded. And this issue of included and exclusion, that we connect with the uh, feeling of 4 seconds in Lac humanum. That if I am excluded, I will be alone. And who are the cousins? Cousins are the people whom I share my inner feelings. I play. I can talk out loud all my secrets. I cannot do that with my parents and my real siblings. But cousins, I can play around and move around. I can have my late night out or whatever is possible. So, in the case that was discussed with the intern, he had that feeling that I'm playing. Aura was that I'm playing with a cousin and I'm excluded. I don't want to be excluded. I want to be with them. If I'm not
Yes.
with them, and the point is, I don't mind proving myself to remain with them, but they are not allowing me to do that. So that is going against my wish. So they are contradicting, and so I feel angry. And at that time, this particular understanding of quick repentance was not with me, nor did I ask further. But in my other cases, where Lac humanum has done excellently well, in that anger is alternating with repentance coming up.
Yes.
And in 2 or 3 cases I have seen, they don't like to be interrupted. Whatever they are
Yes.
doing, if they are interrupted, immediately anger that comes up. So these 3 points which I have seen very consistently about the sensitivity, that they don't want to interrupt it, and anger that alternates with repentance, along with they want to be influenced for साथ में रहने के लिए कुछ भी करेंगे. बाकी जो भी है ना, वो outside reactions है. But main feeling is that if you understand the genius of the remedy that Dr. Bogar and Dr. Boninson has also talked about, Dr. Heinemann has also talked about genius of the remedy. So genius of the remedy, that ultimately what I see is I want to be included in anyhow, I don't want to be excluded from the group. And for that, either you succumb, you fight, or you suffer, whatever is that comes up. This is what, just to summarize what Dr. Samir has narrated. Dr. Samir, thank you very much for voluntarily coming forward and sharing your experience with the novice. And we are also all novice as far as this drug is concerned. One more thing Dr. Samir has brought out about the new remedies. Remedies are there in the nature since centuries, but their curative power is known to us recently, or we started paying attention to it recently. But if we go for any remedy in other pathies, we may find they are used for some or other treatment of the disease. So remedies are never new. We are new to the remedies. We have not paid attention. We have not accepted them. We have not understood, or we have avoided and neglected them because of our whims and fancies. Dr. Henneman said, whatever is around, everything has curative power. Even we have not proved that, but by any substance, if cure happens, then that must be homeopathic to that particular case. If we understand this, then I think whatever different questions has come up from the last discussion, they get the answer. But even then, we are open for every discussion. Only thing we have to take care that this group is for beginners, novice, students, and interns. Our major conflicts or our confusion that can be sorted out differently or in advanced group. But here, our job is to give them encouragement, give them conviction that they can go ahead with the homeopathy. And if we take up this particular task with this purpose, then the purpose of the group, what our interns have started this group, that will be solved. Thank you very much. After this, anybody has any question or they want to say or put any suggestion, we are open for that.
Yes, sir. Thank you very much, both Dr. Samir sir and Dr. Kamlesh sir. If anyone want to share anything, we are near conclusion of this session. Quickly, if anyone want to share anything. Okay.
Any interns or any students will like to share about sessions they are going on, and especially today's session with regard to your learning, your confusion, whether this exercise is helping you, whatever you want to say.
Yes, कोई भी student.
Sir,
Yes,
may I put one question, sir?
Tariq ji.
Yes, Dr. Tariq.
Yes,
Yeah.
Thank you, sir. Thank you. Sir, we find that even classical medicines are not found in our pharmaceutical companies. What about these Lac humanum and xenon and others? We have come across to get cured only by these medicines, but these medicines are not available in the market, sir.
Dr.
Where to
Tariq
get,
ji,
sir.
तारिक जी, आप पाकिस्तान से हमारे साथ जुड़ गए, थैंक यू वेरी मच, वी वेलकम यू.
Thank you, sir.
इश्यू ऐसा है कि such remedies are not available even in India very frequently, but we can get it from some of the pharmacies, or it is imported from foreign countries, or such remedies can be made by the person who wants to prescribe.
Okay, sir. But certain people say that lesser known remedies are not needed when we find holy crests are remedies frequently used in homeopathy. And if I say that this is the only remedy which can cure conditions such as Lac humanum, but they say that if you take the case in totality, you will find another remedy which will be available in the market. So what to answer to them if such situation arises, sir?
Look, Tariq sir, as such we see that in our practice, we frequently use about 25 to 30, 35 to maximum 50 remedies. It means rest all the remedies are lesser known remedies to us because we don't think about them. So that is not the right way of thinking. We have to follow what aphorism number 7 says.
Great, sir. Great.
Disease will take us to the remedy. We don't fit any remedy into the case. We usually do that mistake. That okay, मुझे लगता है कि ये केस नक्सोमिका है, and then I fit everything of the nux-vomica, overlooking something which is not in accordance with the nux-vomica curability.
Sir.
So that one thing which we are avoiding, that is what Dr. Samir Upadhyay was honest enough and very frankly told, that grief from the death or loss, Ignition and Netromure we tend to prescribe.
Sir.
And so they are the most known remedies. And we are overlooking other remedies which may have such. And now repertories are more richer with contribution of such remedies. Only thing, we have to go through the proving or the material and confirm by ourselves the authenticity of that or its matching with our remedies and drugs. So thank you very
Yes,
much,
sir.
Tariq ji. I hope
Thank
this,
you, sir. Thank you.
yeah, okay. So
Sir,
we'll continue to meet. Yeah.
sir, one more question, if you allow me. That was quite short question, sir.
Okay, it is already 11 o'clock, but if you have,
Thank you,
those
sir.
who have to leave may leave, but we will continue with Dr. Tariq.
Sir, these days, especially in India, Dr. Cycle methods is being propagated a lot, and that is kept in view with the aphorism 211. And they say that this is the only mode of treatment which covers pathology, no need of finding any miasm or any other thing. This single remedy is this found only in this mode of treatment which they call Segal's mind method, sir. Sir, I request you to throw some light on it, sir.
Tariq ji, this is a topic by itself.
Sir.
Dr. M.L. Sehgal has put lots of effort and has brought out a different aspect of remedies and the rubrics. What I put across that go through volume number 1 and volume number 2 of ROH series. Understand first
yes, sir.
its philosophy and its derivation of the concept. And then it may be right time to discuss this at length. So those who are interested, please go through this. And then at the suitable time, we will take up this topic to discuss at length.
Sir, I
Is that
have
okay,
books
sir?
with me. I shall discuss, sir. Thank you, sir. Thank you.
So your volume number 1, volume
And
number
2.
2, and 2, and then volume number 4.
1, 2, 4.
Yeah, first start with volume number 1. You may require to read it a couple of times. Whatever idea is putting across, and the ideas are repeated in volume number 2. So go through that again, and then you go to volume number 4 to understand the rubric and its
Okay, sir.
cases. Okay.
Great, sir.
So thank you very much to all the participants that we met today, and we'll meet after fortnight. And please, without any hesitation, write down your views in the our group. And the group discussion will be open for 2 days, and then it will be again closed down only for the post of admin. Okay?
Yes, sir. Thank you very much.
Thank you.
Yeah. Yeah. Good night.
Thank you. Good night, sir. Good night.
Thank you very much, Samir sir and Kamlesh. Thank you.
Thank you very much. Yeah. Good night.
Good night, sir.